Hospital workers. What regrets do you hear from dying patients? She was in her early 40s, a mother of 5, dying from metastatic breast cancer that had spread to her bones, liver, and brain. She had been diagnosed 10 years earlier and had gone through a mastectomy on her left side. Her doctors had recommended a bilateral mastectomy at the time, both breasts removed with reconstruction, because of how aggressive and high risk her cancer was. But she'd refused. She told me her reasoning once. She wanted to leave one real breast in case she remarried. She didn't want to feel like less of a woman. She said she couldn't explain it exactly, just that the idea of losing both breasts made her feel incomplete. She said she never got remarried in the end, never even seriously dated after her diagnosis. I remember sitting with her in the quiet one night, in the dim hospital light, as she struggled with her pain and her thoughts. She wasn't crying, but her voice was flat, almost empty. "I should have just done it," she said. "I'd still be here if I had." It wasn't said with drama or even desperation. It was just plain regret, that single decision. She kept saying she didn't want implants, that she thought she could beat it with just one surgery. Now she was 40, with kids in high school and college, dying by inches in a hospice bed. That conversation didn't leave me. 1 week later, I got my own call. My biopsy came back positive. I had breast cancer too. I was 48. They caught it early, but it was grade 3 HER2 positive, fast-moving, aggressive. I sat in the same kind of exam room I'd helped patients into 100 times and listened to the surgeon walk me through options: lumpectomy, chemo, radiation. But all I could hear was her voice from that night. I should have just done it. When I told the doctor I wanted a bilateral mastectomy with reconstruction, he hesitated, tried to nudge me toward the less invasive option, lumpectomy, followed by radiation. I could tell he thought I was being extreme, but I didn't care. I'd spent too many nights in hospice watching what just one side looked like when it came back. So I did it. I had both removed. I did the chemo, I did the reconstruction. I lost my hair, I lost my strength, and I came out the other side. That was 10 years ago. I've been cancer-free ever since. She was my last patient before my own diagnosis. Last shift before I had to take time off for treatment. I think about her often, about how she opened up to me in her final days, how her regret wasn't about dying. It was about a single decision she made while trying to protect her future, a future that never came. She had wanted to feel whole for someone else, but in doing that, she shortened her time with her kids, her life. I owe her more than I can ever explain. I didn't know it at the time, but sitting with her that night probably saved my life. Her words gave me clarity when I was spinning. When the doctors were giving me choices and percentages and risks, I heard her voice cutting through it. Not afraid, just honest. Sometimes I wonder if she knew that her story would stick with me like that her worst moment would be the thing that helped someone else survive. She was a blessing. Still is.